morning, everyone. I'm Gayatri. I'm a nursing lecturer. I'm working in SNS College of Nursing. Today, we will discuss about one of the interesting topic, deafness. What do you mean by deafness? Deafness is the one of the common condition and also the manageable condition. The deafness is can be the partial or complete inability to hear. It is a unilateral or bilateral condition. Hearing loss can be the temporary or permanent. It can occur at birth or develop later in the life. Millions of people worldwide experiencing the hearing impairment, but it is one of the manageable condition. This is anatomy of the ear. There is the three part of the ear. First one is outer ear, second one is middle ear, third one is inner ear. The three parts can be a vital role to hearing. If any parts can be damaged, the hearing loss can be the cause. How can be hearing works? Sudden waves enter into the outer ear, vibration pass through the eardrum and also the middle ear bones. Cochlear converted vibration into the electrical signals that carry signals to the brain. The brain interprets the signals as the sound. Types of deafness, it can be divided in four. First one is connective hearing loss. Second one is sensory neural hearing loss. Third one is mixed hearing loss. Fourth one is central hearing loss. The first type is problem in outer or middle ear. The second type is damage to the inner ear or auditory nerve. Third one is the combinations of both types. The central hearing loss is the problem in brain processing the sound. Degree of hearing loss, it can be categorized in four category: mild, moderate, and severe, profound. The mild, it is a 26 to 40 decibel. Moderate, it is a 41 to 55 decibel. Moderately severe, it can be the 56 to 70 decibel. Then severe is the 71 to 90 decibel. Profound is the 90 decibel plus above. The causes of deafness is it is some more common causes, the genetic or hereditary factors, the air infections, exposures of the loud noises, aging, and also the head injuries, traumas, ototoxic drugs, birth complications. These are all the common causes of the deafness. The risk factors, one of the risk factors, it is the family history and also long-term noise exposure, chronic ear infection, the premature birth also can be the occur. The certain illness like the meningitis or the neurological infection, the signs and symptoms or difficulty to understanding the speaking, asking others to repeat the words, turning up the volume to high, trouble hearing in noisy environment, delayed speech in the children. It can be the developing age. The children can be the delayed speech, ringing sound in ear, like the tinnitus. The diagnostic evaluation, first on physical history, we have to collect the history from the family history and also the uh, present or past history. We have to collect the physical examination. Through the physical examination, we have to identify the what are the abnormalities. Then hearing screening test, then the audiometric test. It is one of the ENT examination and also the auto emissions and the auditory brainstem response we have to check. Then the treatment option, that is the wide range of treatment options are there. First one is hearing aid, providing the hearing aid to the patient to hear the noise. Then the cochlear implant, the third one is bone conduction devices. Surgery if needed, we have to require for the surgeries, medications for the infections, antibiotics to treat the infection, the assistive listening devices we have to providing. Then communication method, how to communicate to the deafness patients or deafness people. We have to use the sign language, lip reading, speech reading, written communication, visual alerts are captation, speech and auditory training. We have to rehabilitation training to the deafness people. It can be improve the communications to the peoples. Then impact of deafness, communication barriers. First one is mainly communication barrier. Then social isolation. The people can be the isolated from the society. Then educational challenge and also the employment difficulties, emotional and psychological effects, needs for the inclusive support system. Then prevention, avoid the loud Loud noise of exposures and the use productive ear devices treat ear infections at early. Avoid inciting sharp objectives into the ears. Regular hearing checkups, vaccination to prevent the infections. Conclusion, where deafness is a common and also the manageable condition. Early detective improve the quality of their life, and also the modern technology provide the effective solutions to the support are essential. With proper care, and individual with hearing loss can lead to successful independent lives.